What has the Trump presidency meant for public health today? Hi, everyone. I'm Dr. Omar Awan. I'm a physician, senior public health contributor for Forbes, and MedPage Today columnist. Trump has been in office for less than a month, and yet there have been amazing and, quite frankly, very impactful changes with public health with respect to the Trump presidency. And I want to start with January 20th. He had an executive order where he withdrew from the World Health Organization. And the World Health Organization is an extremely important organization. The US spends hundreds of millions of dollars yearly to help fund the World Health Organization. The World Health Organization does really important things like preventing the spread of infectious diseases by giving life-saving medications like to fight malaria, TB, and HIV to many countries, including very poor and low-income countries that need it in order to prevent and curb the spread of many of these diseases. It also is involved in vaccine distribution and vaccine development, things that help prevent infections and even cancers, like cervical cancer, from spreading and from being present in the general population. Also, it helps with pandemic preparedness. If you remember from the COVID-19 pandemic, the World Health Organization was instrumental in sharing data sets, preparing guidelines, things that helped us keep safe. So the United States withdrawing from the World Health Organization does not help us stay safer in America. The other important development is that Trump has freezed foreign aid or to funding to many parts of foreign aid, and that includes PEPFAR, a program that's resulting in decreasing aid for HIV and AIDS. And PEPFAR stands for Presidential Emergency Relief for AIDS, or Presidential Emergency Program for AIDS Relief. That's what PEPFAR is. It was established in 2003 by President Bush, and it's traditionally had bipartisan support since 2003. But this is the first time where we don't see that. And PEPFAR has distributed billions of dollars to help combat AIDS and to end HIV and AIDS. More than 26 million people have survived or whose lives have been saved since PEPFAR started. More than 5.5 million babies have been prevented from having HIV when born from mother to child transmission of HIV. That is an enormous number. If those 5.5 million babies survived and had HIV when they were born, they'd likely require lifelong medications. They'd be prone to having serious infections almost weekly, if not monthly, and they would require critical support, and some of them would even die. But because of PEPFAR, these millions of babies are now living HIV-free and AIDS-free. That's huge. Another really important development is that the Trump administration has decided to halt really important communications and health communications, things like the CDC. They've prevented the CDC from publishing certain documents like the Morbidity and Mortality Weekly Report. They've purged important data on vaccines and, youth behavioral risk factors when we consider mental health and these type of things. This is extremely important for us to understand, and there needs to be an element of transparency in health for us to benefit with respect to public health. How can we stay safe? How can we understand important health developments with respect to, bird flu and infections and best evidence-based precautions when important things and important communications are prevented from us being seen? This is a time where bird flu is spreading. This is a time where respiratory illnesses are still surging, like, COVID, flu, RSV. This is a time where Ebola has been detected in parts of Africa. The public needs important information so that we can survive better and so that we can do better for ourselves and to maintain and uphold and bolster public health. This is not a time to silence scientists. This is not a time to prevent important communications about health from reaching millions of Americans, billions of people around the world. This is a time for everyone to come together and to embrace science and to really learn and to keep things safe so that we stay safe. So hopefully, and I'm praying that some of these decisions are reversed and that there's much more transparency in communication in healthcare, because there's already so much misinformation out there and we can't afford to have less communication with respect to health. Hope that was helpful. Please subscribe to the MedEd page. And as always, please be kind to yourself and to those around you.